The standard 12-lead echocardiogram is a representation of the heart's electrical activity, recorded from electrodes on the body surface. This diagram illustrates EKG waves and intervals, as well as standard time and voltage measures on the EKG paper. The P wave represents the sequential depolarization of the right and left atria. The QRS complex represents the right and left ventricular depolarization, which occurs just prior to the contraction. The ST and T wave represents the ventricular repolarization. The U wave, while not always seen on EKGs, represents an electrical mechanical event at the beginning of diastole. The PR interval represents the time interval from onset of atrial depolarization, the P wave, to the onset of ventricular muscle depolarization, the QRS complex. The QRS duration is the duration of ventricular muscle depolarization, or the width of the QRS complex. The QT interval represents the duration of ventricular depolarization and repolarization, and the PR interval represents the rate of the ventricular cycle. This is an example EKG. This patient presented to the emergency department with chest pain. And so, of course, with every chest pain, we want to rule out a myocardial infarction or heart attack with an EKG. All of the waves that we talked about are clearly visible. You have a P wave and the QRS complex and the T wave. And the morphology of all the waves looks normal. The T wave is about normal width and amplitude. No ST segment elevation or depression. And the measurements for this patient's individual waves are normal as well. Heart rate is 77, which is between 60 and 100. PR interval is 166 milliseconds. QRS duration is 82 milliseconds. And the corrected QT is 430 milliseconds.